Talk Live with Liz, sponsored by TriHealth.
Hey everybody, good afternoon. Once again, cases of the flu already being reported in our area. And in Health Talk Live today, there's also new research on treating COVID-19. So we asked Dr. Stephen Blatt about this twin-demic, as it's called today, beginning with how do we know who should get multiple drugs or treatments for the coronavirus?
We are just learning now how to combine the treatments, which treatments should be given first and in which order, and also how those treatments may work together.
And we're hearing that some of those treatments are poly versus mono, those antibodies. What are those?
So polyclonal antibodies are against COVID and other viruses. Monoclonal antibodies are very specific for the COVID virus.
And does one work better than the other, or do we know?
We don't know yet. We think the monoclonal antibodies will probably be more specific and probably work better in the long run.
And steroid therapy, is that something that, you can give to everyone, or does it only work in certain patients, or are we figuring that out too?
Yeah, so steroid therapy is most appropriate for patients whose oxygen levels are dropping, and we know when we give it to those patients, it keeps them out of the intensive care unit and off ventilators.
Okay, we got to talk about the flu. Is it here?
The flu is here. We're starting to see cases in the Cincinnati area.
So what does that say to you about this year's flu and COVID?
Well, it's hard to say yet, but we know that both viruses are going to circulate, so you need to do whatever you can to prevent yourself from getting the flu. So getting a vaccine and also wearing your mask, socially distancing, all those things will help prevent both flu and COVID.
Okay, so I heard that in some cases the flu will start out differently than COVID. Is that what you've experienced, or?
It's a little bit hard to say. There's a lot of overlap, but some new studies suggest that the flu starts more with cough and sore throat, whereas COVID starts more likely with a high fever.
And then progression, is one worse than the other? Do we know if you can survive COVID but not the flu, or survive flu and not COVID?
It looks like COVID is about 10 times as deadly as the flu, at least the flus that we've experienced in the last several years, but both can be severe fatal illnesses, so you need to respect both viruses.
And do you think that's because we have better treatments for the flu, or that the viruses themselves are more deadly? Or
I think it's the viruses themselves. I think COVID is just a more deadly virus than the standard annual flu that we have, but certainly we do have some better treatments for the flu than we have for COVID also.
And does that have to do with our immunity to it?
Well, it seems like in some patients who have worse outcomes from COVID, their immune system gets overstimulated, and that's what leads to the breathing problems and the need for ventilator care in the ICU.
And we would love to know if you have questions about flu or COVID-19 or anything else health-related on your mind. Just shoot me an email or hit me up on Facebook or Twitter. That Twitter address @LBonus1.